This is me, and as you can see, I'm almost as large as my owl friend here. It was this day I decided to change my life. Join me on my gastric sleep journey. Hi, it's surgery day. I had to get to the hospital at 5 a.m., so I am really tired. I think I might be more nervous if I were awake. Right now, I just feel tired. And I'm a little nervous. It's starting to creep in now that I am actually getting the surgery. So, I hope everything goes well, and I will let you know how I feel right after surgery. All right, bye. Hi, so it is the day after my surgery. Yesterday I was pretty out of it after anesthesia. So today, this morning, I was sore and it's hard to lift myself out of bed, but I am able to. I just have to hold on to something near me. But I'm starting to feel a little more normal. My pain has gone down a lot because they gave me some good medications for that. I'm walking fine. You have to do a lot of walking. My voice is still kind of hoarse because they put a camera down my throat for the surgery. Let's see, what else? Oh yeah, you gotta be very careful drinking. You have to take small sips because I overdid it and ended up throwing up. So, yeah, baby sips and take breaks between your sips. I will be going home shortly. I think I might have one more thing to do before I get clearance to go home. And I'm really looking forward to it because it's Christmas Day. So I'll be happy to go home to my family. All right, well, I will keep you updated on tomorrow. Bye. Hi, so this is day 2 post-surgery. I'm whispering because my family's asleep, but I wanted to journal how I'm feeling today. I still have some gas from the surgery. If you don't know, the surgeon has to fill up your stomach with air in order to do the surgery. So when you wake up, you'll feel really bloated, and it may take a couple of days for that air to come out. So it's still coming out like in burps, and yeah, when I burp it kind of hurts. But I'm glad it's coming out anyway because it's very uncomfortable. That's getting better. My stomach area still hurts a little bit. It feels like if you have worked out your abs a lot, like if you've done 100 crunches or something, that's how it feels. And the doctor will give you medicine for that, or you can just take Tylenol. I've been feeling pretty good today. I was a little tired this morning, but that's because I didn't really sleep well. I woke up feeling a little nauseous, but I have medicine for that, so that took care of it, and I luckily didn't vomit or anything. So far, so good. I guess my only complaint right now is that I do still feel hunger, and yeah, so I learned that the myth that getting gastric sleeve will get rid of your hunger, that doesn't happen for everybody, and ultimately your hunger does return. So right now I'll drink a protein shake or broth or something. Cream of wheat is good. At this stage I can eat cream of wheat okay. So yeah, it's going to be a lot like your liquid diet before surgery, and your stomach will tell you when you've had enough. You will feel it, and don't drink too much too soon, because yeah, you will feel that too. It kind of feels like someone punched you in the stomach, and it takes like 30 seconds to a minute of pain for you to realize I should not have done that. So take small sips, don't guzzle your water. So I'm about to go to bed now, and I'll keep you updated on if anything happens. Hopefully some weight loss. I haven't looked on the scale, I'm too scared, but I'll just keep you posted. Bye. Hello. Day 3, I think it is. Yeah. Day 3 post-surgery. I'm feeling very sluggish. I have low energy, but that's because I don't eat much. I had some protein shakes starting at, I think it was 1 in the morning, because I'll wake up hungry, and then I have to remember I can't just guzzle down a protein shake. Otherwise, yeah, it hurts. It really hurts your stomach. So I had 2 protein shakes today, a little bit of cream of wheat, and unsweetened applesauce. And I have a huge jug of water I am trying to get through, but it's very difficult. And I'm someone who I like to drink water. So yeah, there's a big difference now, because you only have a little stomach, and drinking too much water will cause pain. So when it comes to pain from swelling or the surgery, it's not too bad. I think I can keep most of it at bay with just Tylenol. So that's good. I haven't really had to use any of the other painkillers today. I still have to give myself a shot. I don't know if I mentioned it before, but I have to give myself an injection of a blood thinner so I don't get blood clots. I don't like it. It hurts. I do it, but it hurts. And I have 14 days to go with that. Ugh. Well, I've done it for 2 days now, so 12 more shots left? But I will be so glad when I don't have to take any more prescription medication for this. I kind of miss normality because every day I'm reminded, oh yeah, I had surgery. I can't eat this anymore, or I can't drink that anymore. I miss coffee. And I will reincorporate that into my eating routine. But first, my nutritionist wanted me to meet my water and protein goals. So I hope that happens sooner rather than later because, yeah, I'm tired. And the coffee would help. Well, coffee and food would help. I don't know. I'm just kind of humdrum today. Because I don't see, I can't imagine the long-term results. I don't know how else to say it. I mean, right now I'm just thinking about the here and now and not being able to eat normally and having to drink all these protein shakes. So that's what I'm thinking of, but I'm not seeing results yet, really, except for a little bit, just a little bit. Like my clothes fit better, but I'm kind of, I guess, envying other people who have already met their weight goals. And yeah, I'm like, when is it my turn? Oh, I'm just 3 days out. I can't even picture 3 months from now. But I know I have to be patient. And I guess take everything day by day. But I think I will get some more rest now because on this liquid diet, there's never too much rest, I don't think. Okay, well, I will record my 4th and 5th day so you kind of see the immediate effects or how you might feel shortly after the surgery. So, this is me on day 3 signing off. Bye. Hey, it is day 4 post gastric sleeve surgery. And some new things happened today. First is acid reflux. I haven't felt any acid reflux since having the surgery until today. And yeah, it was kind of uncomfortable. It might have been because I took a lot of medicine on an empty stomach. But they gave me a prescription for antacid, and that helped once I took it. I hope that doesn't become a problem down the road because I've heard that some people it reduces their acid reflux getting the sleeve, and others it makes it worse. So here's hoping it doesn't become a constant problem for me. Next, today was the first day I felt my incision wounds, because normally I do feel my abs, but this time it was my pain was coming straight from my incision wounds. I felt like a sharp cramping sensation. So that was also not pleasant, and it kind of kept me on the couch, because I'm supposed to walk a lot to reduce the risk of blood clots, but today I was in a lot of pain, so the pain went away though. So yeah, those two things were different. Anyway, I guess we can talk about BMs. I did have a fear. The dietitian told me that if you don't keep up with your water intake, you can be very constipated. And I've seen videos on YouTube, people talking about how terrible it was to be constipated. That has not happened with me because I am religiously drinking my water. So if that is something that you're worried about with getting bariatric surgery, just drink your water like you're supposed to, 64 ounces at least, and it shouldn't really be a problem. Everything is fine with me. So yes, take your water. I've been feeling still kind of tired, and I'm really tired of the liquid diet. The only thing I kind of look forward to eating is cream of wheat, no sugar, because everything else I've been eating has sugar in it, like Jello, yogurt, protein shakes, Gatorade. I can't stand the taste of sugar right now. Ugh. So if you can get these chicken broth or beef broth protein powders, do that. I might end up ordering some myself, and I might incorporate some bone broth into my diet. You're gonna get so sick of protein shakes. I'll tell you that now. So yeah, I guess that's one more day down. 4 days, and every day you heal a little bit more. I have not had any nausea. I don't think I've had any nausea since the day I left the hospital. And that's really good. So, I will keep you posted on day 5. Bye. Day 5. Hi. So, today I did a scary thing. I stepped on the scale, and I have a bad past with the scale. Whenever I think I'm doing well, I end up gaining a pound or stalling. So yeah, I was nervous, but it turns out I have lost 10 pounds since surgery. So in 5 days, I have lost 10 pounds. That's great. That's 2 pounds a day. Um, so the day I got surgery, I was, let's see, 272. And now I'm 262. One thing about going on this liquid diet I'm on is you're scatterbrained. It's hard to remember your name sometimes. Another good thing is when I get up from the couch, I don't feel as heavy as I used to. And that was kind of funny to realize. I was like, "Huh. I'm not as exhausted or putting as much energy in as I used to." I think my highest weight, it was in the 280s. So I've lost at least 20 pounds. And that was because I was on a diet before surgery. And then I lost that 10 pounds after surgery. So yeah, 20 pounds lighter approximately. And I've said this before, but clothes are feeling better. And I'm feeling better. When I put on clothes and I don't feel constricted, it does something for my confidence. Because I have always grown out of clothes and then felt guilty buying a larger size. I'm glad that's something I don't have to deal with anymore. And the last thing that I've noticed is I don't need Tylenol as much. Because I took it once today and then I kind of forgot because I was on a schedule of taking pain medicine and I forgot about it. And then when I realized, oh, I normally take Tylenol at this time, I decided maybe I don't need it right now. So that's good. It means I'm healing. So now let's get to some of the negative things I've noticed. I've been tired all week, and it might not be the type of tired where I sleep, but it's just the type of tired where I'm kind of spaced out and don't want to do too much. The sleeping thing, it's weird because I want to sleep, but I can't always sleep. And it's because I can't sleep on my side anymore. It's uncomfortable. So I have to get used to sleeping on my back. And yeah, it's not quite as comfy to me. I also think the liquid diet is a huge factor in my exhaustion. When I get more calories, I think that will get better. Hopefully. Another negative thing is that I can't pick up my toddler. The doctor told me that I can't lift anything 20 pounds or heavier for 2 weeks to a month. And my toddler doesn't understand that. So I feel bad. Sometimes I forget. I can't pick him up. And it hasn't done any damage yet, but I don't want to overdo it, overstrain myself. So my husband has scolded me a couple times, like, remember, you're not supposed to do that. Yeah, so I'll be looking forward to when I can pick him up and not be at risk of injuring myself or giving myself a hernia.
And my last negative thing is that I am still really sick of the food I'm eating on this liquid diet because it's all sweet, it's boring, and I I'm a foodie. So I'm just thinking of all these amazing meals I could be making, and I can't because it's just protein shakes. I've heard people on their VSG or gastric sleeve videos say that after their liquid diet, they never want to see a protein shake again. I can understand that. I can definitely understand that. You have to switch up the flavors or you'll go crazy. So, this 2 weeks can't be over soon enough. Anyway, this has been my 5 days post surgery. And I think going forward, I will update you weekly. And if you have any questions, put them in the comments and I'll be sure to answer them. So take care and remember to drink your water. See you in a little bit. Bye.